Can treatment-resistant epilepsy improve over time? And are melatonin supplements bad for your heart?
And what resources are available for people who rely on emergency rooms for regular medical care? Joining us this morning, Dr. Arjun Venkatesh, Chair of Emergency Medicine for the Yale School of Medicine and Yale Medicine. Doctor, great seeing you again as always. Long-term studies found that treatment-resistant epilepsy may improve over time, sometimes even without any medication. What do we know about that subject?
Hi, thanks for having me. So this is a new study, includes several hundred people, including some researchers from Yale, who looked at people who have epilepsy, which is a condition where you get seizures. And often what we've told patients is if you've got seizures and you take the first medication, it doesn't work, and then maybe the second medication doesn't work, that you may just be having a lot of seizures for the rest of your life. And what this study found is a real sign of hope, that that's not the case. That often people who have these really difficult forms of epilepsy actually end up responding to medications they may get down the line, and how often their brain gets short-circuited and has this seizures also goes down over time. And so it's not that you're going to have an entire life filled with seizures, but that with good treatment, you can actually recover quite a bit.
Okay, and how about these headlines we've seen lately linking melatonin use to heart failure? That's very concerning. What should we know about this?
Many people use melatonin to help with sleep, help with jet lag, after travel, shift workers, you name it. I think everybody needs to have a little bit of caution. This study got a lot of headlines, but it's really early results that were presented at a meeting that have not been subject to the full peer review and publication process yet. And all it showed is maybe an association between use of melatonin and developing some heart problems, not causation between the two. And so the important thing is if you do use melatonin, that you do so with the guidance and advice of your physician or your healthcare provider.
Doctor, we hear about this all the time. A lot of people relying on emergency rooms for more regular medical care because they just don't have anybody to see for routine treatment. What are some ways that people can connect with a primary care physician in the area? Because I know they are very hard to find in a lot of cases.
Yeah, seeing a doctor has never been easy. It's been really hard recently. Post-COVID, a lot of resignations, retirements, you name it. What people need to know is just because it was hard to see a doctor a year or two ago, that doesn't mean it has to be today. There's a lot of things happening locally that change that. Here, we've got a lot of programs where we partner with federally qualified health centers. If your barrier to primary care is language or your barrier to primary care is insurance status, you can be seen at a federally qualified health center. If your barrier to primary care is transportation, there's more and more locations where there's both primary care that you can get in person or potentially even via telemedicine. The important thing is to sort of reach out to your providers, your organizations, their care centers, their Care Connect centers, things like that, to figure out what they've built out to make it easier for you to get seen and hopefully be able to avoid a visit to the ER in the future.
Boy, very important to see and get to those very important doctor's appointments. Dr. Arjun Venkatesh, thank you so much for joining us this morning. Great information.
Thank you.